Welcome to Most Amazing Facts. In this video we are going to be taking a look at 10 medical advancements that increased life expectancy. So, before we get started, don't forget to like the video and make sure to subscribe to this channel and hit the notification bell to never miss new amazing videos. Life expectancy has gradually increased over the course of human history, owing to medical advances. Human life expectancy has increased dramatically in the last 100 to 150 years as a result of scientific and medical advances. In 1900, the average life expectancy in the United States was 49 years, and it was even lower in 1800. Our understanding of medicine, disabilities, and science in general has enabled this significant advancement. Let's look at 10 medical breakthroughs that have increased life expectancy. Some of the advancements listed below date back to the 19th century, while others are much more recent, as scientific advances continue to drive medical technological innovation. Number 10. Germ theory's discovery. We are taught about germs from an early age. Students are frequently reminded to wash their hands. However, this was not the case in the mid-19th century. Instead, the widely held belief was that disease was caused by spontaneous generation. Spontaneous generation is exactly what it sounds like, disease that appears out of nowhere. Fortunately, in 1861, Louis Pasteur, a French microbiologist, demonstrated to the scientific community and the world at large that disease was not caused by spontaneous generation. It was instead caused by microscopic organisms known as germs or pathogens. The medical and scientific communities eventually accepted this theory, resulting in the prevention of thousands of deaths from infectious diseases such as typhoid fever, the flu, dysentery, and others. Number 9. Anesthetics. Surgeries are common in today's society. It is not uncommon for a person to have 3 or more surgeries over the course of their life. Many advances in surgical science have occurred in recent years, but none has been as significant as the use of anesthesia. Prior to the widespread use of anesthesia, it was not uncommon for patients to choose death over emergency surgery. After all, surgery was only used as a last resort by doctors in desperate situations. Without anesthetics, the prospect of surgery must have been terrifying, especially since patients were only given opium, alcohol, or a leather strap to bite on. And, of course, the surgeries were frequently unsuccessful. William G. Morton used sulfuric ether on a patient with a tumor in his neck in 1846 for the first recorded use of an anesthetic during surgery. Number 8. Medicine and artificial intelligence. Artificial intelligence, AI, is a technology that has enormous potential in all fields of science, including medicine. AI technology is also known as machine learning, because software can catalog information more efficiently than humans. AI has enormous potential in medicine. AI systems are currently used in a variety of applications, including patient diagnosis, doctor-to-patient communication, medical record maintenance, prescription cataloging, remote patient treatment, and more. While AI is currently being used to save lives and improve medical processes, the potential for the future is even greater. AI has the potential to screen for diseases, personalize patient care, and even edit genes. It's exciting to think about the advances that medicine and science could make with increased use of artificial intelligence technology. Number 7. Laparoscopic surgery. Laparoscopic surgery, which was developed more than 100 years later, was another significant advancement in surgery. A smaller incision is used in this type of surgery than in traditional surgery. The surgery can then be carried out with less risk by using small tubing and even smaller cameras. For obvious reasons, laparoscopic surgery was first developed in the 1980s and is sometimes referred to as minimally invasive surgery. Among the numerous advantages are a shorter hospital stays and recovery time, less complications, scars that are smaller, less discomfort for the patient. Laparoscopic surgery is almost as common as other types of surgery in modern hospitals, despite being a relatively new technology. Number 6. Organ transplants. Organ transplants have had a significant impact on patients with failing organs and have saved many lives. As technology advances, organ transplants from animals to humans have occurred, including a kidney transplant from a pig to a human. This is known as xenotransplantation. Organ replacements may be able to be created by a 3D printer or even grown in a lab or medical facility in the near future. One of the most significant medical advances in increasing human life expectancy has been organ transplantation technology. Number 5. Antibiotics. The Royal College of Physicians of Edinburgh was asked in 2010 to vote on the most significant medical developments of the previous 50 years. The most significant advancement, in their opinion? Antibiotics were discovered. One of the most tragic accidents in human history occurred in 1928. Alexander Fleming, a Scottish scientist, accidentally discovered a mold in a petri dish. This discovery was penicillin, the world's first antibiotic. While penicillin did not become widely used right away, antibiotics continued to evolve throughout the 1940s. Number 4. ACE inhibitors. ACE inhibitors, angiotensin-converting enzyme, are used for a variety of purposes. They are commonly used for patients with high blood pressure, heart disease, or kidney disease. ACEs, in simple terms, dilate or widen a patient's blood vessels. This increases the amount of blood flow from your heart. ACE inhibitors are frequently prescribed to help lower blood pressure. They are, however, prescribed for heart failure, diabetes, heart attacks, and those who are at risk of heart attacks and strokes. Number 3. Dialysis of the kidneys. Kidney dialysis is a medical procedure that removes waste and excess fluid from a patient's blood when their kidneys are malfunctioning. A dialysis machine is usually used. The dialysis machine filters the patient's blood before returning it to the body. In other words, the patient is utilizing an artificial, external kidney. While dialysis is far from perfect or comfortable, it has saved many lives. Dialysis is frequently used as a stalling tactic. It enables patients to function without a functioning kidney. This time is spent assisting the patient in locating a suitable donor organ. Surprisingly, this medical breakthrough was developed in the Netherlands during the Nazi occupation of World War II. Number 2. Technologies for medical imaging, MRI, X-ray, CT, ultrasound. CT scans, MRIs, X-rays, and ultrasound technology are all advantages of the next technological advancement on our list. It may seem obvious, but for centuries, doctors were unable to see many parts of the body while patients were alive. This all changed in the late 19th century with the invention of the X-ray by German physicist Wilhelm Conrad Röntgen. The MRI is frequently one of the first tools used by medical professionals to make an accurate diagnosis. The advantages of medical imaging are numerous and continue to grow as technology advances. Number 1. Vaccine. The vaccine is possibly humanity's most powerful single tool for disease prevention. Vaccines were developed in the late 18th century. It was discovered out of necessity, as with many great technological advances. The smallpox virus raged throughout the world, causing countless deaths and infections. To combat this epidemic, Edward Jenner was the first to use vaccinations. Smallpox was eventually eradicated through the use of vaccines. Other important vaccinations in the 1800s and 1900s include rabies, tuberculosis, cholera, polio, and more. Vaccines have been developed using new technology due to a lack of resources. New vaccines are being developed quickly thanks to mRNA technology. Vaccines are an important part of our society, and they have undoubtedly saved millions of lives by preventing disease. That's it for today. Thank you guys for watching. That was 10 medical advancements that increased life expectancy. So, we want to know from you guys in the comments what you're thinking. If you liked this video, clicking the like button is all you got to do, it really helps us out. And if you're new, consider subscribing, maybe hit that notification bell. But as always, thanks for watching and we'll see you guys next time.